I'm going to talking about cancer, specifically prostate cancer. I'll be using CA. The short term of cancer is CA. So when I use it, please, I plead your indulgence. Do accept it, please. So I'm going to talking about cancer today. What is cancer? What is cancer? Is every day we hear about cancer. We hear about cancer every day. We hear about cancer every day. So what is cancer? What is CA? What is cancer? What is malignant tumor? Cancer is a generic name. It's a generic term of large group of diseases. And these diseases can affect any part of the body. Other terms that are used to describe cancer are malignant tumors. When you hear about malignant tumors, CA, cancer, then we're talking about cancer. So having been in the medical field for 20 years, there are certain disease conditions that are emotional, no matter how you think you're strong. When you see a patient going through this condition, no matter how strong you are, you go emotional. And cancer is one of these disease conditions. So what is cancer? I've just said it. It's a generic term for large group of diseases that can affect any part of the body. And when this disease affects any part of the body, it's usually named after the organ or the part of the body where the growth is. You hear cervical cancer, breast cancer, lung cancer, eye cancer, lung cancer, brain tumors. You know, it is named after the parts of the body. So today, we're going to be talking about prostate cancer. What is prostate in the first place? Prostate is a small gland in the pelvis and is a part of the male reproductive system. It's about a size of a walnut, located between the penis and the bladder, and is surrounded the urethra. So that is the prostate, and it's found in the reproductive system of the males. Recently, every year, we have about 30,000 diagnoses every year of prostate cancers. And in the recent research, it's more in black males. Is high. The high rate of this prostate cancer is very high in the black males. So it's a situation that I really don't know. Every day, every week, I work in assessment unit currently, acute assessment unit. And every week, every day, months, weeks, days, you see people being diagnosed newly of prostate cancer. Recently, I came across a friend, a family friend. He's just 52. In fact, he urged me, he told me, please, to speak about prostate cancer. So when I met him, when I was told that this family friend was ill, he's paralyzed, I got in touch and I said, what happened? He said, all of a sudden, he stood up, he couldn't walk, the limbs were numb before you know it, the limbs were weak. And when he made all this statement, I said, before then, what happened? He said he realized that he couldn't pee. He had the urge to pee, but he couldn't pee. He was like going to the restroom to pee constantly. The urge to pee never ceased. Because I've been in the medical field and I've seen these cases of prostate cancer, but because he was just 52, I was really battling. Could this be prostate? And I said to him, has it been, I haven't gone for any prostate diagnosis? He said no. I said, this could be prostate cancer, could be prostate. So when I decided to talk about his history, he told me that his dad died of prostate cancer 3 years ago. And that made my suspicions more concrete. So I advised that these tests should be, these symptoms should not be ignored to be something else or just something that just came on its own. So finally, it was prostate. My suspicion was really right. It was really prostate. And it's really emotional seeing somebody that is 52 years going down every day, and you just say, please, sister, can you help me speak to young men out there so that then they don't find themselves in this situation. So that's one of the reasons that motivated me to do this video. So please, this video is for everybody. Could be your husband, could be you as a man directly, could be because of your brothers, your dads, your uncles, your brothers, could be because of them you're coming across this video. So what is prostate? I've defined and explained what prostate is. That is in the male reproductive system. So what happened? When do we say that prostate is there? When there is this growth. When there is this growth in the prostate. When there is this growth, and when we say that there is cancer in the prostate, let me use the word growth, the tumors growing. And initially, when it starts growing, and when it is little, you really don't know, no signs. That's one of the situation that leads people, that makes it more painful. It doesn't have early signs. When it's growing, there is no sign. Usually, there is no sign that something is growing in the prostate. But once the growth has enlarged, that the prostate itself have enlarged, but engulfed the bladder, elsewhere, now it starts to show some signs. By then, the growth has spread. It has metastasis, spreading to other organs of the body around the prostate. At times, it could grow, it could metastasize to the bones and lymph nodes. So when this thing happens, when it gets this stage, that's when, boom, sudden, the man could not pee, straining before, while peeing, endless urge to pee. He's finishing to pee and he wants to pee again. So when these things happen, it's not actually or definitely, when you see these signs, you say it is prostate CA or cancer. But these are red flags, you know. It might be a sign for other issues with the prostate. We have benign prostate hyperplasia. This benign is that it cannot metastasize, it cannot grow, it cannot spread. So it's a different ball game, it's a different thing altogether. But this dangerous one is the one that spreads. It takes years to spread. So what am I saying today? What I'm saying today is every man or the sister, wives to any man in his early 50s, middle 50s, late 50s, early 60s, please go for what is called prostate cancer screening. Prostate cancer screening. Prostate cancer screening is a blood test, usually called the PSA, prostate specific antigen. When it is high in the blood, is a red flag. But that does not mean one who has the high grade of PSA has prostate cancer. But it's a red flag, which your doctor might decide for further diagnosis. He might decide to send you for MRI scan. From the MRI, he could decide to do other checks like digital rectal examination. Is a physical examination of the prostate, known as the digital rectal examination, or the DRE. He can send you for an MRI scan, and if they're not further comfortable, they can send you for a biopsy. It's not an automatic conclusion, but it's a red flag. If the PSA is really high, it's showing that there could be a growth. They can say, okay, let's test this growth. Is it benign or is it a metastatic tumor? If it's benign, the medical team know how to handle it. But if it is the metastatic ones, the metastasis, and is spreading or it's growing, and through biopsy, they now know, yes, this is spreading, is growing. It's not something that happens automatically. They give you first 1 year, come back for a check, the PSA check, and if it is not growing, if the grade is not increasing, it's just that the doctors, the medical team are keeping eye on you because they've seen a red flag already. Then personally, there are lifestyles. There are things you need to do to bring down the risk of developing this prostate cancer. People with obesity, according to research. So if you're obese, you can say, okay, since this is this way, the PSA is high, the man can say, I need to reduce my weight. I need to keep fit. Keeping fit, reducing weight is not actually to look good, but to keep ourselves healthy. So that's what I'm here to say today to our brothers, husbands, dads, brother-in-laws, brothers, uncles, every man out there. Let's look after ourselves. Go if you are up to 50 and above. Please, please, and please. This can be put on the check when they are when it is on the starting point, when it has not spread all over to the body, to the bone, to the lymph nodes. There are treatments to check this, at least to make the man live longer. The medical team will now keep an eye on this individual who has his PSA level high. There are various treatments, like the surgical removal of the prostate. There are the radiotherapy, the radiotherapy aspect combined or alongside with hormone therapy. So at any stage, once it's being dictated at its early stage, one's life can be prolonged by management, treatments, other than this is something that has no sign, that is growing, that has germinated, that is growing, from growing to spreading to other parts of the body, down to the bones and the lymph nodes. It will be quite dangerous when it gets to this stage. But if dictated at the early stage, there are treatments, there are interventions for whoever the individual. I know going for such and it is high could get one anxious, anxiety setting in, depression. But no, you're not alone. The MDT is there to support. It's not the end of the world that one PSA is high. That does not automatically mean that the man has prostate cancer. It could be a red flag for other things, other issues in the prostate. So today, let's check ourselves. Walk into your GPs, doctors, hospitals. Speak to your doctors. Speak to your GP that you want this test conducted. It's a blood test. Let's save ourselves from much of this stress of suddenly this emotional trauma of that the cancer has spread all over the body. Why there are some interventions that could be done early to check these things and to prolong our lifespan. Thank you. I hope this video will help lots of us, lots of our men out there. Thank you.